It shows that the number of people self-isolating after coming into contact with someone with COVID from inside the school has quadrupled in just 1 week. At least 239,000 children didn't attend class for COVID-related reasons on the 17th of June. That's up from 1.2% the week before. Well, parents and teachers are now questioning the government's rules as whole classes and year groups are being asked to isolate when just one child tests positive. Well, for more on this, let's bring in Dr. Rob Hughes, Clinical Research Fellow at the London School of Hygiene and Tropical Medicine and Head Teacher at Burstow Primary School, Claire Hodgson. Good afternoon to you both. Claire, I'll come to you first, if I may. I've been looking at a lot of parents making comments on social media about what's happening in schools in England in particular at the moment. And the key word that keeps cropping up is chaos. What's your understanding of the picture at the moment, Claire?
Well, we've had to shut down one of our year groups. We shut down our year 5 on Friday because we had a child who tested positive in that year group. I wouldn't say that our feedback from parents was about chaos, but I would say that they were ready to swoop in and they were really understanding, which is brilliant for us because it's not anybody's choice, is it? It's a reactive situation, kind of an emergency scenario where we had children in school and in that moment we found out and then had to get them picked up from school. So I suppose it was something that we could kind of plan for, and in the instance when it did happen we had a set of procedures that we went through, so parents were really responsive. So I wouldn't say that they'd said it's chaos in terms of what we've experienced, but it is certainly disruptive.
Yeah, Claire, talk to me about the procedures that are in place at the moment, because a lot of people are saying that the measures that have been imposed on schools in terms of these COVID bubbles, these bubbles that the children are in, whether it's class group, year group, is outdated. This came in at the start of the pandemic. They need to be updated because for this reason, it simply isn't working. If one child tests positive, we're talking 20, 30, 40 pupils being taken out of school again.
I suppose what the government really wanted to do was to have us in as small a bubble as possible. So for us, in terms of how we organise school, children are mixing with each other at playtimes only within year groups. So for my school, we've got 2 classes in each year group, which means it's up to 60 children. Now in other schools, they might be able to organise their schools slightly differently according to space, sizes of classes, how many staff they've got, and they might be able to reduce how many children that affects when a child does test positive. But for us, the smallest that we've gone is for year groups because that's just how we've been able to organise school. So that does impact on staffing, obviously, because that's 6 members of staff that also have to isolate. And that means it's also all of the parents. There's got to be a parent at home with each one of those children isolating. Well, the parent isn't isolating, but home with the child. So that will affect them if they've got jobs that they need to go out and do. They won't be able to go out to do that. So it does have its impact.
Yeah, let's bring in Dr. Hughes, who's been nodding along, because obviously not only are you an expert in the spreading of COVID and how it spreads, but you're also a dad as well. So this affects you on both levels. What can be done better in schools?
Yeah, I mean, I think the first thing to say is that we need to all remember we've lost an awful lot of children and the next generation generally throughout this pandemic. I mean, thankfully, one of the few kind of positives around this disease is that the very low risk directly to children themselves. So we need to be extremely, I guess the first principle is we need to be very careful not to ask more than we need to of children. And that means having a really smart set of policies that really match this phase of the pandemic, that aren't kind of, we've got to remember the vaccination and the vaccination campaign is a game changer, and it needs to be reflected in our policies. So I actually think schools have done an awful lot. Yes, I'd like to see more resources given to schools so that they can enhance even things they have worked hard on, like ventilation. I'd like to see more resources there, but I also think we need to be realistic about our schools' estate, around the staffing numbers. And I think if we can't, if there's a limit to how quickly, for example, ventilation can be improved, that's not an excuse to keep excluding children, keep limiting their learning, their social development, their interaction, these things that really have a lifelong impact.
Yeah, it's really hard for kids, parents and teachers to keep going through this cycle. You mentioned we need smarter policies. Let's face it, the ones that are in place in schools at the moment aren't looking too clever today. Cases up 70% in schools and, you know, thousands of children across England staying at home and the knock-on effect of that. Like you said, mental health, education, parents' jobs. What would be a smarter policy in schools right now to stop this from happening? Is there one, or do we just have to accept what's going on?
Well, I think we need to keep looking and keep thinking. There's certainly not a place where you sort of make a policy in September, October, or even August last year and keep it forever. The vaccination here, and we should be extremely grateful that in our country we have got such high rates, over 60% now double vaccinated, that this has changed what this third wave is looking likely to be. In terms of specific policies, I mean, I'm not well enough briefed to say what should happen, but I think that it's really good that we're trying different approaches. I think it's right that Public Health England are experimenting with things like daily testing for contacts. I think it's absolutely crucial that we really have the right level of what counts as a close contact, and schools and teachers need to be given really clear advice that doesn't force them into isolating whole bubbles, actually says, look, let's take a risk-based approach here and say which children are contacts, which should meet that definition, and not be too blanket around it. And then let's be clear, the calculus in terms of there's harms and benefits for all of these things, and the harms from COVID are thankfully lower due to vaccination and improvements in therapeutics. And so therefore, our countermeasures, we need to really think hard about the harms that they bring too, because it's not that, you know, it is possible to be too careful. I think back at the beginning of the pandemic, move early, move fast, be robust, and we can probably all point to failures then. But I think now we need to be careful about not being too single issue focused. We need to acknowledge the complexity here, and I think that's something the government is doing, and I think all of us, and it needs to also be more than just a scientific conversation. This is a whole society conversation. I think teachers are absolutely crucial here, parents. It's about ethics and society as much as it is about science, I guess.
Okay, Dr. Rob Hughes and Claire Hodgson, head teacher of Burstow Primary School. Thank you very much, Claire. I know you've got a whole year group off isolating at the moment, so I'm sure you'll be looking forward to seeing them back into school when it's safe to do so. Like you said, the children only just back at school then have to come out again. There's so many knock-on effects of that. Thank you both very much.
Thank you.
Her Majesty.